Welcome to Staten Island University Hospital Spine Surgery Education course. We thank you for choosing us for your upcoming surgery. I'm Patty, specialist with the Patient Experience team. My colleagues and I will take you through the course created especially for you and your caregiver. Did you know it's been proven that patient education leads to better outcomes and experiences? And we're happy to review this material with you. Our multidisciplinary spine team is in fact much larger than what you see in this photo. The team is comprised of neurosurgery, orthopedics, anesthesiology, pain management, rehab, case management and social work, advanced clinical providers, perioperative team, nursing, and patient experience. Throughout this presentation, various team members in our spine program will review and explain topics that will help enhance the subject material for you. Allow the complexities and background activities to us. Your main focus should be on the following pillars: what to do and expect before surgery, on the day of surgery, and what to expect after surgery. We have broken down this material according to these three pillars, starting with what to expect before your surgery.
Hi, I'm Lindsay Martino. I'm a physician assistant for the Department of Neurosurgery located at 501 Seaview Avenue. At around 4 to 6 weeks prior to surgery, you may need a physical exam by your primary care doctor. Depending on your past medical history, you may also need specialty input, such as cardiology and/or pulmonology. After required visits have been completed, you will go for a pre-surgical testing appointment. This typically takes place 2 to 3 weeks before your surgery. During your preoperative neurosurgery office visit, we will discuss all the necessary appointments, dates, and provider options.
Hi, I'm Elena, your senior physician assistant at the neurosurgery practice located at 501 Seaview Avenue. During your pre-op neurosurgery appointment, please be sure to share with our clinical team if you are taking anticoagulant medication such as warfarin, also known as Coumadin, apixaban, also known as Eliquis, dabigatran, also known as Pradaxa, edoxaban, also known as Lixiana, ticagrelor, also known as Brilinta, clopidogrel, also known as Plavix, aspirin, that is 325 milligrams. Please note that baby aspirin or aspirin that is 81 milligrams is acceptable to take before surgery. Be sure to stop taking multivitamins, vitamin E, and herbal supplements including ginkgo, garlic, ginger, turmeric 1 week prior to surgery. During your pre-surgical testing appointment, notify the nurse practitioner if you are taking any other herbal supplements or vitamins. We recommend that you stop smoking 1 month prior to surgery. Smoking can result in the following complications after surgery: surgical outcome failure, delayed wound healing of bone and tissue, increased risk of infection, increased pulmonary complications, and increased risk of blood clots. Please talk to our clinical team if you are interested in learning more about quitting smoking. If you would like more information about quitting smoking prior to surgery, reach out to the Northwell Center for Tobacco Control by calling 516-466-1980 or visit our website at northwell.edu/quit-smoking. Contact your primary care provider for nicotine replacement for use during recovery as well. Now that you are informed about all the requirements for medical clearance for your upcoming surgery, we can continue into the next section of the course. In the next section, we will share information about how to prepare for your surgery. It is important to have your home prepared for when you are discharged from the hospital. After surgery, you will need help with tasks such as cooking, grocery shopping, laundry, gardening, and taking care of your pets if you have. When setting up your recovery center, please ensure that you can easily reach medicine, water, your telephone, a box of tissues, something to read, and your TV remote. To ensure your safety, you may want to consider tidying up your home prior to surgery. Set up your recovery center by removing loose wires, remove area rugs, use a nightlight and turn on lights when you get up, secure rugs and treads on stairs, and place a rubber non-slip mat on the bathtub floor.
Hi, my name is Anthony Conrad, and I'm the director of the spine program at Staten Island University Hospital. Now that your home is prepared for your surgery, the next step is to attend your pre-surgical testing appointment. Your pre-surgical testing appointment will be located at 242 Mason Avenue, the Medical Arts Pavilion building. Parking for this building is located right across the street. Once you enter the premises, you will go to the second floor and approach Suite 6B, which is the location for pre-surgical testing. Once there, the clerical team will check you in and a nurse practitioner will perform the medical exam. Pre-surgical testing is a valuable part of your surgical journey. The pre-surgical testing appointment is comprised of a lot of activities and sharing of information. With that being said, please plan for an hour to an hour and a half long visit. During this visit, you will have to share with us the following: a list of all of your medications, including your over-the-counter medications and herbal supplements, a list of all of your drug and food allergies, and if you have received one in advance, please provide the pre-surgical testing intake form. This may have been given to you at your surgeon's office. If it was not, you certainly can fill one out during this time. Also, please bring a list of all of your doctors, your primary care doctor, and any specialty doctors that you might see. After the sharing of information, we will then begin our assessment of you. A nurse practitioner in the office will ask about your medical history, surgical history, and perform a physical exam. If recommended by your physician or if you meet certain criteria, you may have an EKG or a chest X-ray performed. You will also be given instructions on what medications to take on the day of surgery, especially for conditions such as high blood pressure or diabetes. Additionally, you will be informed if you need any additional clearances such as stress test, echocardiogram, so on and so forth. Also, you will have blood work done in the office. Please note, you do not need to fast for this blood work. During this time, the nurse practitioner will give you HibaCleanse soap and instructions on how to use it.
Now you are fully prepared for your surgery date. In the next section, we will discuss what to expect on the day of surgery and your plan of care while recovering. On the day before your surgery, you will receive a phone call from the hospital telling you what time to arrive. Be sure to eat a light meal such as cereal, oatmeal, soup, salad, or a sandwich. Shower with special soap and follow the instructions shared with you in the last section. Make sure that you do not eat past midnight the night before your surgery. On the day of your surgery, make sure you have a small bag packed and ready to go. We recommend bringing personal toiletries, dentures, and comfort items such as a book or tablet. Please bring your insurance card and ID. If you have been diagnosed with sleep apnea and use a CPAP machine at home, please bring it with you. Your personal items will be stored in a secure locker while you're in your procedure. We also recommend wearing comfortable, loose clothing that you can also wear when returning home. If you have a planned stay in the hospital, you can bring extra clothing and a knee-length robe for extra comfort. Please bring a list of medications with dosages and times of day usually taken. If you have any allergies to medicines or food, please bring a list with you. Please leave any valuables such as your wallet and jewelry at home and your medications unless you're informed otherwise by your physician.
Hi, Anthony again. On the day of your surgery, please enter at the 475 Seaview Avenue Heart Tower entrance. To park, the parking lot is located right across from the Heart Tower entrance. When you proceed in the building, you will go through our weapons detection system and afterwards meet with the patient experience liaison. The liaison will check you and your guests in and escort you to central registration, where they will request basic information. Afterwards, you will then be escorted up to the preoperative area where you will meet the care team.
Hi, I'm Dr. Motivala, Vice Chair of the Neurosurgery Department. In the next section, I will take you through the important steps we take while you are in our care in the hospital. In the pre-op area, a nurse will take your blood pressure, pulse, and temperature. Your surgeon will meet with you before surgery to check in and answer any questions you might have. To ensure a swift recovery, you may be given gabapentin, Amend, Tylenol, and/or Celebrex.
Hi, I'm Chris, nurse manager of the pre- and post-op area. While you're in surgery, your family will be updated by phone and will be informed once you are in the recovery room. After your surgery, you will be brought to the recovery room where you will be monitored. Once you are recovered, you may be given a brace to wear when you are out of bed. Once you are in the recovery room, you and your care team will discuss the best option for discharge based on your unique needs. Our clinical team will determine if you should recover in the hospital, in rehab, subacute rehab, or at home.
Hi, I'm Dr. Sunshine. As one of the surgeons on the spine team, our goal is to ensure that you have a swift and safe recovery. If we recommend you stay in the hospital, your length of stay may depend on the type of surgery that you had. If you had a decompression spine surgery, you could expect to stay in the hospital for 0 to 2 days. If you have fusion spine surgery, your length of stay will depend on the type. If it's an ACDF, I would expect a 0 to 2 day stay. If it's a posterior cervical, I would expect a 1 to 3 day stay. If it's thoracic, about 2 to 5 days. And if it's a complex multi-level fusion, I would expect a 2 to 5 day stay. Lastly, if you had a pain stimulator placed, you could expect 0 to 2 days stay. The length of stay varies based on your unique plan of care. If you would like more information regarding your length of stay, please ask your surgeon prior to the procedure.
Your treatment plan for pain management will be tailored for you based on your medical history and allergies to medications. Your pain will subside each day as you heal. If you have any opioids left over after surgery, please bring them to a drug drop-off site. If needed, we have one present in our hospital. Our goal is to keep you comfortable after surgery. We can use a combination of medications to manage your postoperative pain. This combination of pain medications is called multimodal pain management. To prevent clots, deep vein thrombosis, and pneumonia, you will be prescribed medication to prevent blood clots during recovery in the hospital and potentially upon discharge. After your surgery, the clinical team will instruct you on breathing exercises and use of the incentive spirometer shown here. You should use this device 10 times every hour. Before you leave the hospital, your care team will prescribe any new medications to your preferred pharmacy. For your convenience, we can prescribe your new medications to Vivo Pharmacy, located in our main hospital building at 475 Seaview Avenue on the first floor. Your nurse will also give you your discharge instructions, including any changes to your medications.
Hi, my name is Tom Verticchio, and I'm the manager of the inpatient rehabilitation team. An important part of your post-surgical recovery process will be rehabilitation services. The day after your surgery, you will be evaluated by a licensed physical and occupational therapist. And the goal of rehabilitation is to help restore your functional mobility so that you are safe and independent at home. To do this, the therapist will assess your need for a walker or a cane, teach you safe ways to move in the bed, help you get in a chair and onto the toilet, teach you how to walk and manage stairs safely, assess your ability to perform activities of daily living, such as getting dressed or combing your hair, and provide you with any equipment that you will need to do those activities. Finally, they will teach you strengthening activities that you can perform both in the hospital and at home. In order to get you home safely and maximize your recovery, our rehabilitation team will assess your need for home care and outpatient rehabilitation services. They will also provide you with recommendations for adaptive equipment that you may need in your home. While going home quickly after surgery can be distressing, our rehab team is dedicated to providing you with the best care to prepare you for a successful and speedy recovery in the comfort of your own home.
That concludes our course. Thank you again for choosing and trusting Staten Island University Hospital Spine Center. If you have any questions leading up to your procedure, please contact us at the Office of Neurosurgery at 718-226-4940 or email us at siuhneurosciences@northwell.edu. We look forward to caring for you.